Hello Katie, so today we're going to be doing active range of motion for knee flexion and knee extension following your ACL injury. The purpose of this is to set ranges in order to set goals to better restore normal joint mobility, decrease stiffness, and promote circulation to the knee joint without placing excessive strain on the healing of the ACL graft. We need and want to have a controlled active motion to help prevent scar tissue adhesions. So I'm going to have you lay down on your back and with your legs fully straight. So starting with that non-injured side, I want you to slowly try to bend that knee up to your chest as far as you can go, keeping the heel on the ground. I want to make sure that it's controlled, avoiding any pain, and I'm going to measure this with my goniometer. Good. Now I'm going to have you extend the leg all the way back down, trying to straighten the leg back out fully, again trying to keep the movement slow and controlled. I want to make sure that these movements are pain-free. We're not trying to force the end range, and I want that to make sure that we're doing that gentle mobility. So now I'm going to go to that injured side. I just want to be able to check the degrees on the non-injured versus the injured side, so I'm going to have you do the same thing, bringing that knee into a bend as far back as you can go and maintaining slow control. I want to make sure that there's no pain, and I'll measure this. Now I'm going to have you extend the knee again on that injured side, and then I'll measure that. Essentially with this, I'm going to compare both sides, and we're going to set some goals to get this range of motion better. Next, I'll start by demonstrating the Y balance test, which we use during phase 2 of ACL rehab. The purpose of this exercise is to assess and train dynamic balance, proprioception, and neuromuscular control of the lower extremity. After an ACL injury, these systems are often impaired, so improving them is critical before returning to a higher level of strengthening and sport-specific training. So first, I'll show you. So I'm going to have you stand barefoot on the middle of the pole, and then I'm going to have you press forward, and then or anterior, then back in towards the midline, so posterior medial, and then posterior lateral or back away from the midline. The goal of this is essentially to reach as far as possible in each direction without losing balance and letting the stance foot move. I want you to come back and then back forward with that foot. So essentially, I'll have you start on your non-injured leg and have you push as far forward as you can with that right foot. And then I'll have you go posterior medially, pushing back, good. And then I'll have you go posterior laterally. And essentially, we would typically do these 3 times in each of the 3 directions and picking the best distance for comparison. So now I'm going to have you do it on the injured leg, and let me know if there's any pain at all in any of these movements. So forward, any pain with this, posterior medial, and then posterior lateral. And then I would have, again, you do these 3 times. So now I'm going to demonstrate doing a hamstring curl, which is especially important when it comes to ACL rehabilitation. So the reason we perform hamstring curls is that the hamstring acts as a secondary stabilizer for the ACL, helping to resist anterior translation of the tibia. Strengthening them helps protect the new graft, improve knee stability, and restore functional strength for daily and athletic activities. So I'm going to start by laying on the bench. I want you with your legs coming off, and I want you to slowly contract or flex the knee and bring in the heel towards the glutes. I want a slow and controlled motion. I want you to hold the contraction for 1 to 2 seconds at the top, engaging the hamstrings fully. I then want you to contract the glutes as well, and then lower the leg back down slowly, controlling that eccentric phase to build strength safely. So bringing the foot up with the band around your ankle or the weight around your ankle, nice and slow. I want to make sure that you are squeezing your glute and have your knee fully extended so we can get that good stretch as well on the way down. So I'll have you Flex the knee, bringing the heel towards your glute in a slow and controlled motion, and then slowly back down. So essentially at the end of this, I will have you do about 10 to 15 reps for about 2 to 3 sets on each side, ensuring that there is no pain or any compensatory movements from the hips while we are doing this.